Welcome to the Pharma Forum podcast. This is web editor Nicole Raleigh, and today I have with me Rob Abbott, CEO and Executive Director of ISPOR. Welcome, Rob.
Thanks so much, Nicole. It's a wonderful opportunity for me to join you today and talk a little bit about ISPOR, the Professional Society for Health Economics and Outcomes Research. This is an especially auspicious time for us to be having a conversation because we're just leading up to ISPOR 2025, which is one of our annual policy congresses this year being held in Montreal, Canada. And it's also ISPOR's 30th anniversary. So I'm sure in the course of our conversation, I'll manage to weave in a few comments about the journey that ISPOR has been on over the last 30 years.
Quite a journey indeed, Rob, and I'm sure listeners are looking forward to that. So a little bit down into what we'll be focusing on as well today. Today, dear listeners, we'll be discussing the ins and outs and trends of HEOR. But before we get into that, Rob, perhaps you could introduce yourself a little bit for our listeners and share your journey to today doing what you do at ISPOR.
I'd be delighted, Nicole. And it's such a privilege for me to have the opportunity to lead ISPOR. But let me just back up a little bit. I mean, I've spent most of my life, both as an academic and as a professional, attempting to improve human welfare globally. For many, many years, I worked on the front lines of the corporate social responsibility and sustainability movement, attempting to shift human society onto a more sustainable trajectory. And that was work that had me working on 6 continents, advising a variety of global brands on their CSR and sustainability strategies. But global health has always been fundamentally important to me and is really a cornerstone of what I might characterize as a meta sustainability or social responsibility strategy. And so I have spent time as a practice leader for both Deloitte and PwC. I'm a past chief executive officer for the Canadian Genetic Diseases Network and the Canadian Gene Cure Foundation, which, as the name suggests, has a lot to do with gene-based medicine and gene therapies. I've also had the opportunity to serve as the CEO of Health Technology Assessment International, which is the leading professional society focused on HTA globally. Now, with ISPOR, ISPOR is the Professional Society for Health Economics and Outcomes Research. And as such, the focus with ISPOR is very much on the value of a particular healthcare intervention, how we think about value in the context of the quality of life of a patient, and how a particular intervention competes with or compares relative to similar products in the market. And my work and the work of my team is very much now centered around how do we position health economics and outcomes research as a key lever for decision makers and decision shapers globally, such that we can create a world in which healthcare is actually accessible, effective, efficient, and most important of all, affordable for everyone. So that's what really animates me. And there is something of a through line there in terms of my own personal journey and my desire to improve human welfare and what we're now trying to do with ISPOR and our new vision and new strategy.
Thank you, Rob. Your own personal journey as well as this 30-year journey of ISPOR. So let's go over to the Health Economics and Outcomes Research, or HEOR, and its role, as you mentioned there, this word lever, this lever for healthcare decision makers. How is it so? And who are these healthcare decision makers that can benefit from that lever?
So if you think about decision making in most healthcare systems globally, obviously there's a role for the doctor, so to speak, and his or her interactions with the patient. But fundamentally, decisions are made by health technology agencies. They're made by government bodies. Academics have a key role to play from a research perspective. Patient advocacy organizations are increasingly engaged, and collectively, All of these players have an influence on healthcare decision making. I could extend that and talk about med tech companies and technology companies more broadly. Investing and investor communities are increasingly active. And so, what we want to be able to do is, firstly, we're a science based professional society. Everything that we do is grounded on rigorous, robust science. And we fundamentally believe that the best policy and the best outcomes for patients are ultimately built on a foundation of good science. But we want to make that science accessible to these various decision makers so that they're able to understand fairly clearly, okay, the evidence suggests that this particular intervention is actually going to convey more value to the patient, enhance their quality of life to a greater degree. Because what we're really trying to do is ensure that scarce resources are allocated to the highest value interventions, those that will actually bring the very best that medical science has to offer to the largest number of people.
Thank you, Rob. So I want to look more closely, perhaps, to the trends surrounding this seeking of highest value interventions. And last year, ISPOR released its top 10 trends report for 2024 to 2025. And I was wondering if you could share just some surface level takeaways from that report, Rob, and tunnel down into any that you yourself are particularly, or ISPOR is particularly positive about.
Sure. And it's important for your listeners to appreciate that this is something that ISPOR does every 2 years. And the top 10 trends report, as we call it, captures global healthcare trends by conducting horizon scanning around the world. And this is where the truly global nature of ISPOR, I think, is important, because we have members and chapters in more than 100 countries around the globe. And we draw on that extraordinary geography to inform insights with respect to health economics and outcomes research trends. So in the most recent report, what we found was that real world evidence, artificial intelligence, and patient centricity were three of the big trends that were driving healthcare decision making. And I'm happy to drill down a little bit into those, but it's perhaps not surprising to your listeners that real world evidence and artificial intelligence would be at the top of the list, because they're obviously much in the news. But I think at the end of the day, it's really important for your listeners to understand that everything we do is about the patient. Everything that we do is ultimately in service of getting better outcomes for the patient. And so I was personally really gratified to see that patient centricity was emerging as a key trend in health economics and outcomes research. And I would be so bold as to say it's a fundamental trend in healthcare more generally.
Thank you, Rob. So, yes, indeed, I am going to ask you to go a little deeper with those
Sure,
top
sure.
trends from the report. Let's start with real world evidence, perhaps. What can you tell us more about
So
that coming to the forefront?
the first thing to talk about here is that outside of the controlled randomized clinical trial, how effective is a drug or a healthcare intervention in different populations in the real world? The clinical trial is still a key component in the evolution of, for instance, a drug's journey from lab to patient. But real world evidence allows us to supplement the clinical trial experience and the clinical trial data by saying, okay, is there a more realistic view of patients and health outcomes in practice based on real experience? And so real world evidence gathers that evidence through patient reported outcomes, electronic health records, a variety of means, but crucially after the product has been in the market. And so this enables us to see with much greater clarity whether or not a particular intervention is doing what the trial suggested it would do, that it's delivering back to that notion of is it effective, is it efficient, is it affordable, and so on. So real world evidence analyzes data from a wide and diverse group of patients and allows us then to say, okay, based on the patient experience, this is what we can divine in terms of the efficacy of that particular intervention. Incredibly powerful, and I suspect something that is going to be with us and will be refined for some time to come.
Thank you. To be honest with you, those words could perhaps describe the second overall global trend of artificial intelligence, incredibly powerful and to be refined for some time to come. But also that sort of trio of hit points that you mentioned with real world evidence being efficiency, efficacy, and affordability. These are three things borne in mind along the journey of implementation of AI. So, what can you tell us about this digital tool usage, as it were, Rob?
Firstly, perhaps the standard caveat with respect to artificial intelligence. Things are progressing very quickly, and I don't want to suggest that I'm on my metaphorical soapbox, advocating for a kind of omnibus approach to AI. This is something where from a healthcare perspective or from a health economics and outcomes research perspective, more specifically, I think there's some really exciting potential. And we need to ensure that human intelligence is in lockstep with the machine learning so that we get the best outcome again for the patient. So, with that caveat said, I think that machine learning algorithms can yield insights that improve healthcare decisions. I think that as real world evidence becomes more prevalent, artificial intelligence can process and analyze results from both trials and real world settings and allow doctors and other healthcare decision makers to get tailored outcomes, bespoke treatments, if you like, as well as enhanced economic benefits. I mean, the promise here, again, back to one of my core principles, the promise here is that we continue to find new and better ways of bringing the best that medical science has to offer to the greatest number of patients at reasonable cost. So I think that the other piece here, and it kind of leads us into the patient centricity element as well, is that the application of AI is also increasing the advancement and use of digital health tools, whether that's remote monitoring devices, mobile health apps, wearable sensors, and so on. And this has the potential. I mean, some would say we're already there, but I would still position it as this has the potential to truly empower patients by putting more control and insight into their own health management, allowing them to actively track their health metrics, compile real time data that can be used in health economics and outcomes research for more personalized and responsive care. So I don't know that we're entirely there just yet, but that certainly is one of the reasons that we're excited at ISPOR about the potential for AI. And it's one of the reasons that over the past year, we've started an artificial intelligence working group within our society to examine some of these questions and kind of surface what are some of the areas that still need further investigation. But there's no doubt AI is here and it's going to be a disruptive force in healthcare. We want that disruptive force to be for the benefit of patients.
Absolutely. So, excitement at the potential. If we, as you said a second ago, actually, Rob, it leads nicely into tunneling down further into this fundamental centricity of patient centricity. So, you've got the in practice element of real world evidence, you've got the potential of AI, and then you've got this empowerment through focus on the patients. Can you tell us more about all of it, actually? Everything you've been describing leading to this more clearly defined patient centricity, where the patients themselves are permitted through the healthcare system and through their own utilization of these new digital tools, perhaps this more personalized and responsive care come from self-health management?
So this is really, we're kind of skipping to the bottom of the metaphorical page, because this is really where, everyone has skin in the game, because we've either been patients ourselves or we know patients. We're going to go through this patient journey at some point in our lives. And for some of us, we'll go through this multiple times. And so, firstly, from a definition perspective, patient centricity from ISPOR's perspective, this is about putting patients at the center of healthcare research and decision making. And that may seem like a somewhat trite statement, but the reality is that when I talk to patient representatives, when I talk to patients themselves, all too often they feel actually disempowered, or they feel as though their particular situation is not necessarily being given the kind of attention that it perhaps could. So this is fundamentally about putting patients at the center. And what we want to do is create a healthcare environment where patients' experience, expertise, and knowledge is valued and harnessed for better research and ultimately better health outcomes for patients worldwide. A year ago, we convened our first ever global patient summit. We've had patient roundtables for a number of years at ISPOR, but last year at our 2024 North American Congress, we actually brought patients and patient representatives from around the world together. And it was just, on the one hand, it was incredibly inspiring, but it was also really quite poignant for me, because I was hearing firsthand from patients these stories about actually not being enabled and empowered, not feeling as though they were at the center of their particular patient journey. And so I want everyone to understand that at ISPOR, we believe that patient-centered research and a patient-centric approach to our work generally, it allows us to understand that patient journey in much greater and nuanced detail, because everyone is unique. It's important for us to understand what patient preferences and experiences actually are, so that we can gain better insights into what patients consider to be success. And this is a really interesting thing, because on the one hand, there's a calculus that says, well, if you are suffering from disease X, this is kind of what you would want, and there's this very quite hierarchical approach to I will tell you what's best for you based on my medical experience and expertise. Well, we don't want to sideline that entirely. We have to respect that medical expertise, but we have to also respect the patient's wishes. How does the patient think about success in the context of his or her journey? What are the side effects that they might be experiencing from a particular treatment protocol? And are they willing to put up with that? Or is there something else that could be considered? So increasingly, and this is a key takeaway message, I think, for your listeners, increasingly ISPOR, as an advocate, as the global advocate for health economics and outcomes research, we're integrating patient preferences and outcomes and using data such as patient-reported outcomes, real-world evidence, quality of life metrics, to help ensure that treatments align with what matters most to patients. And I think this has the potential to be a genuinely transformative impact in healthcare decision-making. The other thing I would add is that as part of our new strategy, we've acknowledged that as a professional society of health economists and related scientists that love to measure things, we have historically looked at value in a really quite narrow way. And it's become increasingly clear that we need to open up and expand that definition of value to include what we're referring to as whole health. And this is a term that in a North American context particularly is gathering quite a bit of momentum. Outside of North America, concepts such as broader well-being and so forth are rising quickly as well. And the basic idea, I think, is intuitively obvious to most patients. It's like, yes, Like there are a whole host of factors that influence my health. Some of them are physical, certainly, but many of them are not. And again, if we actually engage in deep conversation with the patient and understand what their hopes and aspirations are, then we're better able to tailor not only our research and methodological work, but we're able to tailor treatment protocols appropriately.
Thank you, Rob. Well, you sort of preempted my penultimate question, which was going to be, given that ISPOR is celebrating its 30th anniversary year, whether there were any big plans. But I mean, you've shared with myself and with listeners that ISPOR started an AI working group, that last year, 2024, was the first patient global summit, and that there is an aim now to open up and expand the definition of value into this whole health zone, as it were. I mean, are there any other big plans, Rob? And are there any final thoughts for our listeners on HEOR?
So thank you for the opportunity. Yes, 2025 is the big year. It's the 30th anniversary. It's officially the first year of our 2030 strategy. And the 2030 strategy is anchored by that, for me at least, bold and exciting new vision of a world where healthcare is accessible, effective, efficient, and affordable for all. As part of that, we are doing all of the things that I've suggested, but we're also going further. And I think this is an important message as well, because again, just to be transparent, we are living in, shall we say, an interesting time. And there's a great deal of policy volatility, if I can put it that way, especially in a North American context. And although ISPOR is headquartered in North America, I want to return to the idea that we are a truly global society. We have members across over 100 countries. And with that in mind, one of the things that is central to our 2030 strategy is expressing ourselves more forcefully on the global stage. So later this year, alongside the other activities I've highlighted, we'll be convening a real world evidence summit in Tokyo, Japan, that really serves as a stepping stone towards broader engagement with the Asia Pacific region. We're also engaging with our colleagues in Latin America, in Central and Eastern Europe, the Middle East, and Africa. And this is all part of a very intentional stepping forward and bringing the very best that health economics and outcomes research has to offer to the global community. Because at the end of the day, 2 billion people worldwide don't have access to medicines. They don't have access to the kinds of treatments that those of us in the global north routinely take for granted. And so we're going to be stepping into what I see as something of a void, certainly for health economics and outcomes research, and bring the experience and the expertise that we have to that global community. Because again, back to this notion of putting the patient first, if we can shift the trajectory of the patient journey for some of those 2 billion people, we've made a demonstrable impact on improving human welfare globally. So that brings us full circle in a way as far as my own personal aspiration and journey is concerned. But I think this is very much central to who we are and why we exist. This is about enabling and empowering people to live richer lives by virtue of being healthier.
Thank you, Rob. It's been an absolute pleasure.
Thanks so much, Nicole.
And so that concludes another episode of the Pharma Forum podcast. You can find more information about this episode, including a download link and information about previous installments at pharmaforum.com/podcasts. The Pharma Forum podcast is also available on iTunes, Spotify, Amazon Music, Podbean, and pretty much wherever you get your other podcasts. Just search for Pharma Forum and press subscribe. Of course, don't forget to visit our website itself, where you can sign up for daily and weekly news and analysis bulletins. And do follow us as well on X or Twitter and LinkedIn at Pharma Forum. That's all for now. Thank you for listening.